morning, good afternoon, good evening to everyone. This is Dr. Marco Bardus. I'm an assistant professor in public health. I'm the chair of the SPHR Network on Health and Risk Communication. It is my pleasure to host you today to this new webinar with Dr. Santosh Vijaykumar. Is an associate professor of health communication at Northumbria University in the School of Psychology. He leads the Climate and Health Informatics Research Program called CHIRP. I hope I pronounce it correctly, which is a multidisciplinary group investigating the origins, the spread, and impacts of misinformation and conflicting information online. His work sits at the intersection of risk perception, information behavior, and public response to health and weather-related emergencies, and spans collaborations with practitioners and policymakers in Europe, North America, South Asia, and South America. I think without much further ado, I'll let Dr. Vijaykumar to present. So Santosh, the floor is yours.
Sure. Thank you, Marco. First of all, before anything else, I do want to congratulate Marco on the award for leading the Health Communication Network. I think it was very well deserved. And just also a really good reflection of the community that you've been building. So of course, again, I'm Santosh Vijaykumar. I am at Northumbria University, and then my work just really, of course, broadly sits with the intersection, as Marco mentioned, of public health risk communication and information ecosystems, right? And so the work that we are going to be talking about today was just recently published, in a natural hazards journal, and where we just basically ask a deceptively simple question, right? So when disaster strikes, can we just basically measure the gap between what people need to know and what they actually receive, right? From an informational standpoint, and can that sort of evidence, can that insight basically be used to develop real-time rapid communication interventions that actually people can use to keep themselves safe. All right. And so, so that's of course, it's like a series of 3 studies and spanning across 4 countries, nearly close to about 900 participants. And just towards the end, of the talk, just are really hoping to share some breaking data that we have, as we're calling it, from Bangladesh and South Africa as well, which I just really hope will just sort of open the floor for a bit of a useful discussion, right? And then so I know, of course, that many of the participants, of the colleagues here may probably be from public health background, and of course, so climate change is one of the most sort of consequential determinants of public health. So floods, heat waves, extreme weather, and then they don't just simply damage infrastructure, but they have sort of well-documented health impacts. Ranging from mental health impacts to serious loss of lives and livelihoods as well, right? And then so of course there is a risk to the social determinants of health as we understand it, right?
Santosh, sorry, do you want to share your slides?
Oh,
sorry, I didn't understand if you were talking just to introduce the webinar.
Oh yeah, so
sorry, the slides were not visible at the moment.
Can you see my slides now, Marco?
Hold on.
Oh, I thought these slides were already visible.
No.
It's
okay.
No?
It's okay. No, it's fine. I didn't want to stop
no,
stop
worries.
completely your stream of thought, but I
No worries,
wanted
no
to
worries.
ensure that you had these.
Thanks for letting me know, actually. Okay, is this
okay? And then
is this better?
Yes, now we can see
Yeah.
them.
Okay.
Sorry for that.
Great. Okay. Cool. Sorry about that little glitch. But yeah, and then so of course, so there is of course a well-documented link between not just climate change, but also with weather-related disasters, of which we are actually kind of beginning to see an increasing frequency and undocumented public health impacts, right? Ranging from mental health to loss of lives and livelihoods. And so these can, of course, just really, have some serious consequences on the social determinants of health as we know it, right? So yeah, kind of, so before I just really delve into our research, just to share with you a story, right? Is in the latter half of last year, yeah, kind of, so you basically think of Gilgit Baltistan, which is a highly mountainous region in the far north of Pakistan, right? And so this is one of the most mountainous regions on Earth, and it just it's like likely home to more glaciers than anywhere, outside the polar regions. And so it's like communities out here have basically, lived alongside glacial flood risks. It's like, for generations now, right? And so one of the nights when it's sort of it's like nice and calm, a shepherd called Wasiat Khan, he basically goes up it's like to the mountains in the middle of the night, and he basically can it's like, hear like a glacier burst, right? It's like, but at the same time, he wants to inform his fellow villagers. Um, but all that he just really has is a cell phone, and he's just simply not able to get the signal, right? So he climbs further up. He knows like a spot where he can actually get the signal, and then he manages to to inform someone in his village, and then the announcements go out, right? And so with that one phone call, right, yeah, kind of, with all the people who are just kind of managed to evacuate in a rush, it basically saves about close to 300 lives, right? Um, and the official early warning system, of course, it had failed to trigger, right? And so once the glacial flood basically kind of came down, the village was of course fully submerged, but there were zero fatalities, right? So no loss of lives with this one phone call. Right? So what does this story tell us, right? So first of all, the phone call literally was the early warning system here, right? Yeah, kind of, so on the right hand side of your screen, you basically see a glacial lake outburst flood early warning station, right? And this is of course sort of like symbolic of the millions of dollars of investment that have actually gone into bolstering early warning systems and stuff like that. But it basically failed to work when it mattered the most, right? And so the 300 villagers were of course sleeping at the time had no information and no inaccurate information even, right? So there was a serious lack of information per se, and it just the thought of what would have happened if the shepherd actually had no signal is quite scary, isn't it? Right? And so of course it does merit mentioning that on the back of this episode, and I don't believe this was the only one, the UNESCO actually kind of, so they basically the United Nations, they basically kind of ordered a review of the early warning systems in the region, right? And so we were already looking at, you know, um, at infrastructure damage. We're basically looking at a complete paucity of information. But at the same time, uh, the villager was basically kind of, or the shepherd was actually, he was a member of the community, right? So well trusted source, right? And so his voice was trusted and people took action on that basis. Okay. And so, and then of course, again, we zoom out from Gilgit, Pakistan to a more global picture where we are, of course, now, tackling, the misinformation crisis on a daily basis almost, right? With the proliferation of social media channels where I think that, so people are, it's like, constantly worried about distinguishing real information from fake information. We of course also know that it basically takes the truth about 6 times to reach the same audience as a falsehood, right? So misinformation just spreads a lot faster, And then, of course, yeah, kind of, so misinformation has also, of course, been ranked as one of the top global risks. From our work in misinformation, especially during the pandemic, as I'm sure many of you would be knowing, so misinformation has posed serious risk, right? Right from eroding trust in vaccines and in vaccine hesitancy to actually, um, just having some pretty deleterious effects on social cohesion, and so on and so forth. And so that really brings us to the question about how exactly do we tackle this problem, right? Both in the context of what we have seen with the Pakistan story, as well as the misinformation crisis. So in public health, of course, we have basically seen two approaches being broadly used, right? So uh, which is the first um, set of approaches basically called debunking, which is sort of the default setting for public health institutions or for public health organizations who are battling a misinformation crisis. And so debunking, of course, just really deals with correcting misinformation after it spreads, right? Um, you know, but then we do have studies that have basically shown that that there can likely be backfire effects where corrective interventions can actually further fortify people's beliefs in misleading claims. And debunking interventions are, of course, it's really quite tough to scale them, especially in times of urgency, right? And then it is, of course, more of a reactive approach. So which is why researchers, especially from Cambridge, have actually been doing some really fascinating, valuable work around developing pre-bunking approaches, right? Which is really premised on inoculation theory, right? And so where you're basically kind of trying to um, seed misinformation in people's cognition to just really bolster their ability to detect it in the future, right? And to strengthen their ability to detect it in the future. Yeah, and of course, yeah, kind of some of the trials that have basically been done using pre-bunking approaches are, of course, quite promising. The results are quite you know are definitely quite noteworthy. But at the same time, I think for these pre-bunking approaches as well to just really be taken up, for example, at the level of the local councils, and then to basically be able to, implement it scaled, further to communities in a way that it actually has a tangible effect, is quite, is quite a challenging sort of prospect, really, right? And so both approaches, of course, so they basically look at misinformation as the problem, and and we are just really asking, why does misinformation emerge in the first place, right? So is there something that we can do, right? And so several studies, especially in the misinformation space, will basically, will tell you that misinformation outbreaks are usually preceded by an information void or by an information vacuum. And that makes sense because the thing is, yeah, kind of, so when a health emergency or a weather-related emergency happens, right? I mean, I think, um, you basically are in this information environment that is characterized by certainty, by a lack of information, possibly some conflicting information, and all of these sort of conditions just really create a fertile ground for misinformation and for alternative theories to basically start germinating, right? Because people want to make sense of what's going on. People basically want certainty, right? And so once that happens, yeah, kind of, then it's like rumor and conjecture basically starts taking place, and then you basically have a full-blown misinformation outbreak, right? And so um, it's like, so we are just really asking that, that when we know, and then when we have spoken about the fact that, that misinformation outbreaks are basically preceded by a void of information, what can we do to actually detect these voids, right? How can we detect it? How can it be measured? And then how can these voids actually be used to, uh, to just really respond to health and climate emergencies, in an evidence-based, but also in a rapid manner, right? And then the reason why weather-related emergencies are, of course, um, so vulnerable to these sorts of infodemics, uh, to use the language of the World Health Organization, is the fact that, of course, um, uh, nearly a quarter of the world's population is now, uh, it's like, really exposed to significant flood risk, right? And then these floods have, of course, got, they basically have a massive economic toll and a massive social toll as well, right? And so back in 2024, of course, it's like, closer home, and in Europe we basically have have the case of one of the worst floods experienced in recent history, with about close to 335 lives lost, right? And then so what happens is the telecom infrastructure usually tends to be among the first casualty of floods. Just also like uh, you know a situation that they just really commands it's like real-time updates, um, you know, and it's super important, but it's just also very tough to come as well, right? And then so mass evacuations, right? That kind of, so that just basically kind of, so starts um, a severing trust in interpersonal networks as well. When these evacuations just basically come, all of a sudden people are panicking, risk perceptions are high, and then so on and so forth. Yeah, and so just give me 1 second. And then so we were now just really looking at, how exactly can we actually capture these information voids in the context of these, say, weather-related emergencies. I mean, and do bear in mind that floods are not the only one, right? Yeah, kind of, so we are also talking about it's like, heat waves and hurricanes and so on and so forth, right? So from the work, the precious little that has actually been done in the space of information voids, right? Yeah, kind of, the economists were, of course, among the earlier ones to basically kind of, to look at this concept in the context of, uh, in the context of insurance. But at the same time, the work that they have basically done, it just basically looks at that information voids only, as an absence of a credible and trustworthy, it's like, it's like credible and trustworthy information, right? So there is only the lack of information that they are primarily looking at. And then there was this group from the World Health Organization that basically did, it's like, so some it's like pretty useful work on detecting information voids by looking at social media data, right? And then specifically at Twitter data, or X as it's known now. Okay, but at the same time, so that basically also means that uh, it basically tends to exclude, millions of people. It's like, communities who are not on Twitter or on social media even, right? And then of course there has basically been some literature talking about information vacuums from the standpoint of crisis communication, right? So which basically looks at how do it's like organizations actually deal with crises, right? Okay, but that piece of work again just really tends to focus more on the organizational perspective as opposed to what really affects people or publics at large. Um, okay, so based on the review, of literature, including kind of including some frameworks that have actually been previously, been developed from the emergency communication community as well. Yeah, kind of, from the likes of the WHO and then the CDC, which are more sort of prescriptive on the lines of guidelines, plus as well as, yeah, kind of, so some ongoing work as well. It's like, we basically developed a four-dimensional sort of conceptualization of information voids, right? Where we are basically, it's like, saying that an information void really needs to be measured along four key dimensions, right? So the first one is, of course, quantity. And in quantity, we are basically talking not just about a lack of information, but also about too much information, right? Because too much information can basically also tend to it's like, confuse people, can tend to frighten people, right? So these are our problems with serious sort of psychological implications, right? So too little or too much information is basically defined. This is defined as a quantity void. We have basically defined a quality void as something, as the distance between perceived accuracy, it's like, versus, uh, you know, the ideal quality of information, which is basically fully accurate information, right? Okay. And then a source void is the difference between it's like, trusted sources and then sources that were actually accessed during an health or a climate emergency. And a channel void is basically the distance between a preferred channel and a channels that are actually available at the time, of a weather-related emergency, right? So across the four dimensions, we're basically looking at the distance between what people perceive and then what is the ideal, right? Okay. And so the quantity and the quality voids were basically measured, it's like, based on 12 informational parameters specific to floods based on previous literature, right? And then it's like, so the quantity void was basically the difference between the perceived quantity um, and then, ideal quantity, which is basically not too much or not too little, right? So on a 1 to 21 scale, this would basically be the perceived quantity minus 11, right, which is the midpoint. And the quality void is, of course, the, the, the difference between perceived quality minus 21. Sources, of course, it's like, trusted versus accessed, or access versus trusted. And then the channel void is, of course, accessible versus the preferred channels as well. All right. Um, so let's look at, yeah, kind of, so it's like, and then we basically, we generated the questionnaire items based on a review of literature. Uh, I have just basically kind of, spoken to you about the scoring. We then, of course, it's like normalized all void scores on a scale of 1 to 10 using min-max normalization to just make it quite easily interpretable for people. And then we basically measured the reliability of the questionnaire using an omega scale as well. And so basically use this a questionnaire across three studies. The first one was, of course, in Belgium, in the context of Storm Boris, and then followed by Germany and Poland. And then we just basically also had an opportunity to test this instrument in the context of hurricanes as well in the US through uh, our US collaborator, right? So let's look at what some of the early findings tell us. Is, of course, in terms of the reliability as well, right? I think, yeah, kind of, so we basically found that the quantity and quality are probably the highest and in the most coherent sort of scales. Uh, the source scale basically had like a pretty good it's like, reliability, which basically reflects diverse it's like, trust relationships. The channel void was more bordering around certain acceptable levels, right? That kind of, which is probably quite expected given the contextual variation, right? So we basically had like an overall it's like a reliability range of between 0.65 to 0.95, which is sort of it's like between acceptable to very good or excellent, right? And then um, so we basically first piloted this instrument in Belgium, right? And so we basically detected it's like so all four voids using the Bonferroni correction. Yeah, kind of so the instrument was able to it's like detect the four voids. We did basically found that you know people were actually not too worried about the quantity of information or about the quality of information, but the source and channel voids basically seem to be a lot more pronounced, right? And the key finding here is, of course, the fact that it's actually not it's like concerns about what they received, but about how they received it and through whom they basically kind of it's like received this information. Um, okay, let's look at it's like some of the findings from Belgium, Germany, and Poland, right? So this is, of course, more of like a cross-national comparison. And we just basically also wanted to see whether the tool can actually detect as like national differences, which it did. And so Poland, of course, basically reported the highest void scores across all dimensions and in pretty large effect sizes as well. The specific statistics from the the uh, R Menova and then the follow-up t-tests are all in the paper which I can share with you all, right? And so the quantity void was consistently the least severe in all three countries. Okay, uh, and just basically also showed us about the fact that that Poland basically has the most centralized as like flood risk management structure of all the three countries, and and so which is why you probably see more of a problem in Poland as compared to the two other contexts where flood risk management, flood risk communication is actually more of a regional matter, right? Okay. So because as the slide says that the centralized system basically kind of creates it's like bottlenecks. We then basically wanted to look at some cross disaster data as well. Yeah, kind of so like I mentioned before, we administered the survey in the context of Hurricane Helen in Florida, right? And so we then basically, of course, found that the tool that we basically designed, it is adaptable to disaster contexts beyond floods as well, right? And so all four voids were sort of in the medium to slightly high range, right? And so you might recall that uh, in the context of um, the hurricane in Florida, I kind of there was a lot of it's like, misinformation, disinformation, you know, around FEMA, right? The Federal Emergency Management Agency, right? And so that just basically seems to have amplified, yeah, kind of, so some of the quality wide scores here, right? And then we then, of course, basically also found that, you know, the source and channel voids are probably at a comparable level to quantity and quality, which is of course slightly different from what we've seen in Europe. All right. And so yeah, kind of so to just basically kind of compare it across the four it's like four study contexts. Yeah, kind of so we basically found that that you know the quantity void is the lowest void everywhere, right? So people are not it's like people seem to have sufficient information or at least close to the right amount of information, right? But the source and the channel voids tend to be consistently high, right? And so that's the real like communication failure is the fact that the information is basically not being delivered through channels that people trust, or that people actually prefer, right? Okay, and of course, yeah, kind of, so Florida, of course, basically had the highest quality voids. And so, of course, and the misinformation context in the US is, of course, it's quite rife as well. So that doesn't seem too surprising. And so Poland basically had the highest, overall voids. And so the thing is, and so and some of these patterns we basically see replicating across it's like, Europe and the US, right? And so I think from this set of slides we can just basically go one level deeper to basically see when we talk about these voids about quality and quantity and source and channel, what quality parameters, what quantity parameters, what kinds of sources and channels are we talking about, right? Um, just going to have a quick look at as a time to just basically see how I'm doing. Um, okay, great. Yeah. So I'll wrap it up as soon as I can, right? So just, um, okay, great. Yeah. So the thing is, right, I mean, I just just wanted to, yeah, kind of, give you like a quick sense. It's like, it's about the fact that the quantity and the quality dimensions, yeah, kind of, so consistently across the different contexts, the the flood impact areas and the flood arrival timing, right? So the spatio-temporal, information basically seem to be the most highest concern. Okay. And in the timing and the impact area as well, right? I kind of, so both for the quality and in the quantity voids, right? I mean, I think, so we basically saw that the timing and the location of the floods were it's like something that people were most worried about. And in terms of the source and channel voids, I mean, I think, yeah, kind of, so emergency officials, again, yeah, kind of, so especially in Germany, Poland, and Florida, right? So people basically wanted more information from emergency officials, but they simply weren't getting much. And in the channel void is, of course, it's like receiving email, it's like, base information, right? I mean, or receiving information through email actually was basically rated as the highest voids across all the four countries, right? So I'm just gonna it's like, quickly share some breaking data from South Africa, where it's like, so we, because I've just literally received this data set about a couple of days ago, right? And so it's like, South Africa just basically seems like a bit of an outlier in the sense where the quantity and the quality voids are actually way more pronounced than sources and channels. Okay. And in Bangladesh, it's like, so we just basically also found like a significant gender gap, right? And so one of the it's like biggest voids basically tended to be around social networks and weather related apps as well. And so we had, of course, adapted the same questionnaire to the context of heat waves in Bangladesh, right? So the disaster context is quite different, right? And so just basically kind of, looking across the different countries, yeah, kind of, so South Africa basically seems as the main outlier, where, I mean, I think, across most of the other contexts, we basically see the sources and channels void as it's like, the most, yeah, kind of, dominant concerns. Um, right? I'm just gonna quickly to see if I've missed anything. But yeah, but I think and in terms of the source voids as well, I mean, I think, Bangladesh, the social networking gaps, like, certainly seem like something that they need to be addressed. All right. So what exactly are the key implications for emergency risk communication moving forward, right? That kind of, so we do know that that proactive void detection can actually just really help uh, to detect and to react to misinformation outbreaks. And so just kind of, some recent work by a research group in Italy, so that basically shows, yeah, kind of, where they analyzed a lot of data around the COVID-19 pandemic. And so they basically found that the information voids and in detecting information voids can actually predict the misinformation outbreaks, right? Um, you know, um, we basically also, of course, know that we basically don't need information only from official agencies, but we basically also need information from trusted, it's like community voices, right? And we basically also know that the structural disruptions are predictable in the context of weather-related emergencies. Um, so it's like, so we basically need to be planning for information dissemination while accounting for them, right? Okay. And so there is, of course, it's like, still a need for regional customization, and then for more synergized, yeah, kind of, cross-border interventions as well, especially in the European continent, right? And then there is definitely a case to be made for these for integrating these perception mapping surveys as part of early warning systems, right? So there is already work going on around us, like, developing social hydrological models of flood risk prediction and so on and so forth. So we are basically saying that that detecting information what should basically be integrated into those efforts. The study limitations, of course, yeah, kind of, so uh, I'll just kind of quickly run through it in terms of the fact that I kind of post event recall, mostly English language only. So we it's like, surely need to adapt it to the different languages. We really weren't able to gather any spatial data as part of this effort, but we are working with collaborators on trying to expand on that front. And I mean, as well as we are just basically also trying to now work with emergency responders, urban planners to just basically kind of, on a bit of like a Delphi review to basically get expert validation of this survey as well. And so I think the tricky part has, of course, been to basically set it's like severity thresholds, right? So what's a low void, what's a medium void, and what's a high void, right? And so we anticipate it's like, some of these thresholds to basically be set by the communities themselves. Right. And in terms of a future research agenda, of course, yeah, kind of, the main priority is, of course, to basically make sure to reach actually, digitally excluded populations. We would definitely want to rope in, for example, community champions out here in the UK, right, as key sentinels, and who can actually work with, for example, the local councils to just really help them to detect information void, so that we can also have trusted community members as part of the whole infodemic management system as well. And then we are in the context of course, yeah, kind of, integrating these insights with AI-based communication, and then just basically also trying to expand our work to, you know, to glacial lake outburst floods, to heat waves and wildfires as well. Yeah, kind of, so gloves. And the aim is, of course, the fact that we really shouldn't have to depend, or the thing is, we can just really figure out ways to just even incorporate folks like the shepherd in Pakistan, who actually alerted his community in good time as part of the whole infodemic management system, right? So I know that was a lot. I just will leave the room open for questions and a bit of a discussion as well. All right, thank you so much.